all. We are so pleased to present our work in progress today to this group. Yesterday we heard really inspiring words and phrases like integration and health equity and collaboration and social determinants, and we are a concrete example of those aspirations in Cottage Grove. It is very fun work and it is very messy work, okay? And you all understand that. Ms. Verna and I represent the Healthy Cottage Grove community, whose motto is Cottage Grove for Life, and whose values are loving, inclusive, fit, and welcoming to everyone. Cottage Grove project involves many partners. Some of them are up here. We have primary care, churches, universities, housing, schools, and Cone Health, which is one of North Carolina's largest and most comprehensive health systems, where I serve as the Director of Community Outreach. Cottage Grove is located in Guilford County, North Carolina, in the city of Greensboro, which is just under the N in North Carolina in the map above. And the neighborhood boundaries are outlined right here. I'll show you in a minute where we're located within Greensboro. This is a snapshot of the neighborhood. All of the parcels in orange are tenant-occupied residential parcels. All of the yellow ones are owner-occupied. And then right in the middle, you can see sort of a yellowish block. That's Hampton Elementary School. And then sort of those grayish blue areas are some of the light industry that's located in the area. Mostly residential, a mix of long-term residents and also some newer folks, including some immigrants from West Africa and a significant number of Burmese families living in apartment homes. We are about a total population of around 4,000, 4,500 living in Cottage Grove. And there's one very special home that's right on Apache Street, where the president of the Cottage Grove Neighborhood Association, Ms. Verna has lived for almost 25 years. Here is Ms. Verna, and here is Ms. Verna. Back here in 1991, she is preparing to serve the cake at her housewarming party. We found this picture in an album that also included the invitation to her party from January 19th, 1991, and photos of the brand new home that Verna bought herself.
Looking for a place to buy a home, riding around in the city, Apache Street was my first option. I heard that they were building new homes in that area, that they were very affordable. When I first moved to Cottage Grove, I was concerned about the community, the surroundings, and the upkeep, making sure that the streets was clean. Years later, people would bring garbage, tires, and appliances from their neighborhood over to my neighborhood, and I had to get that straightened out. And in a while, it looked a whole lot better. Right now, the city has come and put up signs, do not dump stuff on this street. Back when I moved here, jobs were plentiful. In the back of me was a factory, and on the next street, there were also factories. But as the years went by, there were no jobs in this area now. The apartments on the street have become run down and are not being kept up. They have roach infestations that create a high risk of asthma. But we have a strong group from the Greensboro Housing Coalition who is helping people make those homes repairs and making landlords to work on infestations and mold. One of our council members has a strong relationship with the apartment owners and can convince them to make changes when no one else really can. Here are additional photos from the housewarming party with the founding pastor, the late Dr. Walter M. Richmond of New Hope Missionary Baptist Church, in the gray suit, presenting the dedication of my home to God, and my parents and brother on the right, sitting with me on my couch in my new home. I also included a poem about friendship that one of the guests at the party brought me. This church is still standing in the Cottage Grove neighborhood, and its community development group is a member of our leadership council for this project. Now I'm president of the Cottage Grove Neighborhood Association. I'm up here in Chicago talking to you about my neighborhood. The neighborhood has changed. People have moved in from other countries like Burma, West Africa, and Mexico. It's just a blend of cultures. Joseph Lyon, who is from Burma, is working in our community garden and also leading the English as a second language classes. Another young man in our community, Yusuf Rolakolo, is from Nigeria family, and he volunteers with the school kids at Hampton Elementary, teaching a robotics class on the weekends.
It was important to Verna and I to show you those images of Cottage Grove because those images of friendship and hope and love and dedication are a really critical part of the Cottage Grove story. I'm getting ready to show you also some images of the real challenges that Cottage Grove faces, but as I go through these next few slides, we want to ask that you not lose sight of the hope you saw in those pictures at Verna's housewarming party. If you look here, there's a study of North Carolina's distressed urban tracts. You can see that red star on there. Hope you can see it. Within that red shaded area, there's a concentration of distressed economic areas on the east side of Greensboro. And actually just to the northwest of Cottage Grove, the next census tract up and to the west, is in the top 10 of most distressed places in North Carolina. So try and remember that red shape because you'll see a similar outline again in the next few slides. This map's darker shapes, and the star again is where Cottage Grove is located, are those with the highest unemployment rates in Greensboro, again concentrated in that sort of shape on the east side. The unemployment rate is around 25%. Per capita income is less than $11,000. That's less than half of the Greensboro average. And around 46% of children in the neighborhood live in poverty. These are always the depressing slides that we say, but they're important. These are important links, of course, to health. In terms of assets, looking at this, we have a map of median home values, and of course, the darker side's reverse in this map. So we have a lighter area where Cottage Grove is located. Median home value is around $94,900. This is about a third less than the average median home value in Greensboro. We have Cottage Grove is a neighborhood in which residents are less likely than the county average to have health insurance or to have a high school degree. And there's a heavy burden of illness in Cottage Grove. This map represents homicide deaths in the area, but other things as well. We've talked about asthma and, of course, chronic disease. We're learning through this and other projects to do a better job of using the medical record to be able to assess community health needs and implementation strategies. We looked at emergency department visits in 2014 just from Cottage Grove. We found that we had 2,674 emergency department visits from the neighborhood. 899 of those were non-acute, so triage level 4 and 5 is what we used for that standard, and we had charges for those 900 visits of over 1.1 million in 1 year for one neighborhood. We have one individual in the community who had been to the emergency department 34 times, and we have many others who return for chronic disease, for behavioral health, for other things that would probably be better treated out in the community settings.
So how does a dedicated group of people commit to the community, take on these overwhelming challenges bit by bit and with God's help? We began with a community survey, over 300 residents asking people several questions. Included, this was one about what changes they would like to see in the community. Myself and 9 other residents conducted this survey by going door to door in the neighborhood. And it was clear that having a health clinic in the neighborhood was the #1 desire. 60% of the residents chose it, and jobs and community center were the other 2 top choices. So we're getting to work on these goals. We have a primary care clinic, Mustard Seed Community Health, that will open its doors in December. The clinic will have 1 physician and many outreach workers doing home visits to help people manage and control issues like diabetes and asthma. We have a project called Hampton's Saturdays at the elementary school that turns into a community center on the weekends with reading, arts, gardening, and music for Hampton kids and families. New Hope Missionary Baptist Church offers a high school equivalency, English second language, and job training courses. We also are working together to clean up the stream that runs through the neighborhood and participate in the city's big sweep this year. All of these activities has inspired confidence from others outside the community too. Our council recently received $125,000 from the Blue Cross Blue Shield Foundation of North Carolina. To build a community center health home where neighborhood residents can go to the doctor in our neighborhood, and the neighborhood works on projects to make this a healthier place to live. Our specific goals for Healthy Cottage Grove community include a number of outcome and process metrics, and we have included just a few here. We want to make it possible for people in Cottage Grove to go to the doctor right in the neighborhood, and for the neighborhood itself to become a healthier place, where homes are free of mold and asthma triggers, traffic travels at a safe pace, and children can find parks and sidewalks free of litter and debris to play in. We want a strong neighborhood association that truly represents the residents' voice and concerns, and to develop leadership in our residents to advocate for the neighborhood.
So we have a number of leadership competencies that we believe are critical to success in Cottage Grove. So I mentioned learning how to collect and analyze hospital data. That's one technical skill that we think is important to measure our progress. But one of the most important leadership roles for us, especially for those of us who don't live in Cottage Grove, is to respect the neighborhood leadership as exemplified by Ms. Touraine and the people that you saw in that photograph, many of whom are still committed to the neighborhood. All right, so this is not a picture of Cottage Grove right here, but we do have a t-shirt to give away to someone who can name one of the people that they see in that photograph. Do you recognize anyone, any inspiring leaders? Yes?
Okay, so on the left, that'd be Martin.
It is, yep, that's right. That one's Martin Luther King, a very young Martin Luther King who was. And anybody else that you might recognize? There's a woman in there who hung out with him, yes? Yeah, absolutely. So this is Martin Luther King, Pete Seeger, Rosa Parks, and the Reverend Abernathy, Ralph Abernathy. And then in the front is Miles Horton's daughter, a young daughter who was a teenager. This is at the Highlander Center, where these folks gathered to retreat, to plan, to learn nonviolence techniques, and to set together, I think, many of the strategies in the architecture of the Montgomery bus boycott. This is actually later than that. This is back celebrating the 25th anniversary of Highlander Center. And we just have a story that resonates for us from Miles Horton, the man who ran the Highlander Center. He called his autobiography The Long Haul for a very good reason. And he told this story of his mother Elsie's example. She worked on health issues in a community that struggled with poverty. And I kept thinking of this story when I heard Dora and Marvin and Leanna and Raj yesterday. I think that much of the spirit of this story is in their work as well. So we're going to read you a short story and then talk a little bit about it. As soon as she got there, Mom became terribly concerned about the high birth rate around Monteagle. The families just kept having more kids, and the kids were hungry half the time. She started telling people about birth control, and it was very unpopular. They had thought Mom was a good Christian, and here she was advocating birth control.
There was a woman there who had 7 kids, all about the same age. And Mom decided she'd talk to her. And this woman said, "Oh, I don't agree with that. My father was a Baptist preacher, and we're against that kind of thing." She didn't want to hear any more about it, so Mom just changed the subject. She wasn't put out, it just hadn't worked. It just didn't work.
4 kids, and 4 years later, this same woman came back. My mother was on the porch again, and this woman came in and sat down by her and said, "Mom, what was you talking about the other day?" and Mom just finished the sentence and went on as if nothing had happened. People always liked Mom, even if it took them several years to want her to finish a sentence. They'd always come back. So to me, this is a great story. It's a guiding story for me, and this type of leadership is not at all simple. To resist the urge to tell people how to live their lives, to resist the urge to think that you know how other people should live their lives, and instead to invest in relationships, to walk alongside instead of in front, is what we believe is the basis for real change in the Cottage Grove neighborhood. And it's why Verna and I both represent this project, and why the voice of the neighborhood is central to our work.
This means that the neighborhood association has 5 votes in our council, while each of other agencies has only 1. It's why everything from the color of the t-shirts to the project evaluation will probably get talked to death before we make a decision. So we struggle with inclusive leadership, but we are committed to inclusive leadership because change has to have a deep roots in order to last.
Our hope with Healthy Cottage Grove community is to learn from the leaders of the past,
to inspire the people committed to Cottage Grove, and to develop healthy leaders, healthy people, and healthy places for the long haul in Cottage Grove.
Thank you.
Thank you.